Well, hello out there to all you amazing PEMF people. Welcome to our Thursday Live. I'm Dr. Jerry Dreesen, the Executive Director here at the Association of PEMF Professionals, where our goal is to help you succeed in not only learning about your device, but best practices and how to market. And I want to welcome you, those here for the first time. There's a ton of stuff out there on this channel. If you're watching it on Facebook, if you're on YouTube, if you're on LinkedIn, you can watch past recordings of our Thursday lives and also learn a little bit more about us by going online to our website. But before I get into that, let's talk about what we're going to be talking about today. And this is number 3 of our 4-part series that we're doing. We did safety and side effects. We did latest research. Today, I want to talk a little bit about some of the PEMF devices, not so much companies, because there's a lot of them that are out there. And we have 4 or 5 companies that are part of our organization that have jumped in. And I appreciate your sponsorship, I guess. But I also looking forward to connecting and doing a live with each of our companies as well. So next week, of course, is our final of the 4-part, which is biohacking. But this week, we are talking about PEMF devices and finding your fit. Some of you already have devices and you really love them. You're looking to maybe expand, or is there a way to take care of your device? How do you take care of it? That would be through the manufacturer as far as their recommendation, but also we'll be going through some of the other things as far as attachments and things like that. So let's jump in. For those of you that are joining us for the first time, as far as what is PEMF, so I'll be walking you through that here with this slide. And so what is PEMF? And it's post-electromagnetic field therapy. And it uses an electromagnetic pulse to stimulate healing. Now, I use PEMF in my practice. Excuse me. I use PEMF in my practice, and some people are like, "Oh yeah, I've had this before." My doctor, they sold me a unit I have at home, and that's a TENS unit. And so probably the first barrier to break through is the difference between an electrical stimulator versus PEMF. And that if you can get the person that's experiencing it to understand that, then it's going to make a big difference. But what's really cool is all the research that's out there, which we've done. But the benefits are to reduce pain and inflammation, promotes tissue repair, relaxation in animals and humans. I mean, I have patients that sit on the mat for 10 minutes and they're passed out by the time I come back and see how they're doing. In the vet area, arthritis, fractures, post-surgical recovery in pets and horses. Same thing with humans. Those of you that have been following me know that I have like before and after pictures of a person that broke their arm, and PEMF healed it at a record pace, probably 30% faster. And why it matters, because it's non-invasive, it's drug-free, it's safe. And for chronic conditions and wellness, there's a whole webinar that's all about how to live longer. And the number one way to live longer is to reduce inflammation. Inflammation comes in all kinds of stuff, things that we eat, the environment we're in, the stress that we have. So PEMF is one of these things that helps de-stress our system, our cells on a cellular level, really. And so that's the overall about PEMF. Now let's dive into a little bit deeper as far as the things that are out there. So there are PEMF mats, there are pads, full body or localized mats for humans, and also for Well, so there's people that treat bears, grizzly bears, giraffes, tigers. So there's ways of doing it for these animals as well. But usually, if you can get them on a pad and have it on low, our cats climb up on our laps and they just kind of hug the device and get really close to it, and they fall asleep on it. So that's as close to non-placebo as you can get. Those of you that are work with animals too. The other thing, as far as the some PEMF devices, to come with a larger system, and that's where you set the frequency. Some of them are automatically plugged in, programmed, and you just click a couple of buttons on it. Others have dials, and then there's different attachments. So you have adjustable frequencies based on what you want to do. If you want to do pain relief or healing, if you're doing bladder incontinence or you're doing bone healing, you're going to have different settings for that if you have an adjustable unit. And as far as arthritis, so hip dysplasia, laminitis, muscle soreness, the examples too is like the PETS PEMF pad, the Omni Minimat, MagnaWave PEMF blanket. There's all kinds of products that are out there as an individual, but also some of them are based on attachments. Now, there's also handheld PEMF devices too. These are a interesting set of units, but the overview is that they're a portable device for targeted treatment like joints on animals like hooves. It's a low frequency. They're lightweight. The battery operated, more for precision. And so like tendon strains and fractures, humans have them on their knees and their ankles and their shoulders. And there are a couple of different companies out there that make those. And again, what's nice about that is it's portable, so you don't have to lug your huge machine around with attachments. It's just a light portable. Downside is it is battery operated, so it's only as long as the battery lasts, and you won't be able to have as strong of an output, but you necessarily don't need it, especially if you're not going to be doing super deep care or sessions. Then we've got loops and coils, and I like to call these the needles, because you can take a very small double loop, and that has a really great, like a 2-inch diameter punch right over an area that you want to hit. So if it's like a biceps tendonitis, or if they've got, again, broken bone, for prostate, there's lots of different ways that you can use the loops. You can hang it over the head if it's a larger loop. And again, that does brain and does, organs and shoulders. So you can kind of get a twofer, because the loop doesn't just send it in one direction. It goes both directions. So oftentimes somebody that has PTSD from a car accident, I'll take a loop and I'll put it over their shoulders. If I want to work just on the brain, then I'll take a small butterfly and open it up, and they wear it like a hat. Again, there's different devices for these things. And so the functionalities, again, you are able to have a larger frequency going through it. Very versatile for limbs. And again, those of you that use it, you know that if you're doing a wrist or a shoulder, you can have it, and a knee and an ankle, you can have it at a lot higher intensity than if you're doing it over where there's more muscle, because you get more of a jolt with the muscles as it's going through the system. So oftentimes what I do when I'm placing it is I'll turn it up just to where I see the muscles jumping, then I'll back it down a little bit. Some patients, they've had it before, and they like it when their muscles are jumping, and they're like, crank it up, doc. And those are people that have been using it for a while. So I wouldn't recommend that as a first time for people, because there's a big detox that could happen when you're going through something like that. But there are many different things. When we first started, there was nothing out there. You can actually do a type on the internet now and do a search for, large PEMF loop, and you're going to see all kinds of different products and brands. Again, buyer beware. Make sure you're working with a company that's been around for a while. Some of these are kind of knockoff, and you can't guarantee, the safety of the devices. So if you ever have a question about coils and products and stuff, get in touch with us. We'd be more than happy to tell you our version of what we know about these companies. Again, wearables, these are, kind of new for those of you that haven't been outside of just your unit, but there are jackets and, blankets, like, you got the shoulder, you got the knee, things for animals as well. Again, you can focus this right over an area, and the person you can rent it from you. If you're an affiliate of the product, they can buy it, and you get a small amount of money from that. You can set up a business that way too. So again, there are a couple of different examples of companies that have things that are out there. And I always like to bring them into the clinic and use the larger unit, because I know that I can zero it in where it needs to be. And I just know that with technology, the battery ones are going to get better and better, but you got to be careful. I mean, some people they're actually out there saying, okay, there's a phone app that's PEMF, and all you have to do is plug that into the headset, and it's a little crystal, and you put the crystal where you want it to be, and that's PEMF, and it's not PEMF. that's their thing, what they're talking about. But just, again, buyer beware. And always run, if you think it's kind of funky, run it by us. And like I said, we're more happy to reach out to you and tell you what we found to help you out. Choosing the right PEMF device. Well, again, it depends on what you're trying to go for. It's condition and species. So, is it human? Is it arthritis? Is it a horse? Is it overall muscle wellness? Those kinds of things. And so there are different ranges and different powers. And there's probably 5 or 6 videos we've already done on that. Of course, when you're a member, we go into that too on the membership side. Lots of information in there. And then think about portability. So if you are just going to keep it in-house, like we do in our clinic, we have a tabletop unit. It's very heavy, but it just stays there. But we also have a portable unit. And so, we go out to different events and use that. So it depends on what you want to do. If you're portable, make sure you got something that saves your back. It's on wheels, or you've got it in a cart or something that you can, lug around, because the bigger devices are heavy, but they need to be in order to provide you the different strengths and frequencies. And again, safety and quality. There's more and more companies that are out there that are trying to turn a quick buck. So they'll make something that shoots out sparks. So you got to be careful there. And if you can get FDA regulated devices, more and more regulations are coming. So make sure your devices are from companies that have that focus as well. So as far as the summary today, again, PEMF devices, there's mats, there's handheld, loops, wearables, and systems. They treat pain. They aid in recovery. We all know that. There's lots of things that are out there that talk about that. It improves circulation. It decreases the inflammatory responses, which helps speed up recovery. Even in the microscopic level, what's going on as far as creating more energy, the ATP from an ADP using the Krebs cycle. As far as clinical impact, again, safe, non-invasive, non-toxic, safe for animals and humans. Plants, if you're germinating seeds, now that it's spring, if you want to get a good start on some seeds germinating, just put your plant right in the center of your double loop and turn it on for a little bit. As far as innovation, again, home and clinic devices make PEMF accessible for animals and humans. There are a lot of you out there that are on the animal side. My son had a business where he's going out working on dogs out in the field. And, you know, the one guy, the best quote I ever heard was, he put the pup back in my dog. And it did. It turned this shepherding dog from just kind of hanging out on the field to just running around and doing his job again. He was happy. So again, there is all doubt removed from placebo when you see it actually happen to animals, those of you that have ever worked with them. And then as far as next steps, heck, if you're not a member, why not? We're a organization that's all about helping you out. And also certifications. And what are the certifications? Again, we teach you from our experts, you know, our horse expert, our small animal expert, human expert. We take you through the coursework so that by the time you get certified in that area, whether it's just, you know, red light, if it's PEMF in general, human, animal, large animal, with those certifications, you have the knowledge on what to do. So that helps edify you when you're going out and marketing yourself, but just, you know, just that knowledge, what's going on too. So get on board. If the company that you bought your device from doesn't educate, then that's what we're here for too. And that's why we do these little weekly Thursday lives, so you can get a little bit of a piece of what we're talking about on the inside of the membership. So wrapping this up, some things that you can do. If you're already a member, like and share this so that other people that have devices, they get a chance to see us. It just helps thicken our algorithm so that we are, you know, more of a process. So you can go to our website, you can grab blogs, you can like those. You can take our blog information and jump it into your website blog if you have, or Facebook or Instagram. Again, things that you can do. We have an Instagram, so you can share that as well. Facebook, which is some of you are on right now, and LinkedIn and YouTube. But if you go to each of those places and you like today's video for us, again, that helps us be seen and become more relevant in the eyes of people that are searching for what we have. We do have on the inside, we have a different Facebook page for members only, and you can jump in there and ask any questions that you want. We have our code of ethics. I always like to show this because it really does show who we are, what we're about. If you have any questions, if anybody's like, well, who are these people? You know, are you sure that they're above board? And that's why we have this, because yeah, we are above board. We are you. And so from that, again, those of you that are looking on our website, PEMFprofessionals.com, that's where you go. You can find out more about our certifications and becoming a member. There's also some really cool stuff when you are a member. We have a insurance that's available. We also have a buyer's product that you get where you can get discounts on food, on gas, on all kinds of things. So if you're a traveler, just even hotels and trains, planes, and automobiles, I guess. I don't know if there's any discount on automobiles, so I might have to re-edit today's broadcast. But if you have any questions on what we're all about, who we are, how to get involved, again, reach out to us, and info@PEMFprofessionals.com. Some of you that are in the know that politically we're out there helping you out, and Lauren is out there. Again, once we get more information on what's happening, those of you as far as on the veterinarian side know that there's some regulations coming about. But again, it's just mostly people that are on these boards, they've never seen PEMF before. So we're trying to get out there and educate them so that it's a no-brainer for them to allow, you know, people that use PEMF to get out there and use it on animals and people. So with that, again, I want to thank you very much for your time today. I see we got a couple people watching live, and glad to see you on. This is a recorded version too, so you can always drop your thoughts in afterwards, and we get to see those as well. So I will leave you today with a heartfelt thank you for being part of this, and look forward to talking with you next week. And again, that's where we're going through some biohacking. So pretty cool talk we'll be doing next week as well. So look forward to seeing you then. And with that, take care and have a great day. Thanks.